Hi, my name is Kelly Parker. I'm a nurse practitioner in women's health. I'm back again to discuss different health issues that maybe women have encountered and hopefully clarify some things and teach you about your own body so that you have a clear understanding and then vision of how this could all improve your health and what you can do to improve your own health. So, one thing I say to patients when they come into my office and say, I'm moody, I'm gaining weight, I don't feel good, I want you to test my hormones, is to explain to them that hormones are different all through your lifespan, and they're not always to blame for the symptoms you have, or there's a reason why they're different than what they were last year. So let's start with just a quick physiology lesson on how ovulation works and how your hormone works. Before you ever have a period, women have very low hormones, estrogen, progesterone. There's no progesterone, estrogen's low. And then as you get older, what we call menarche, when you're starting to ovulate and when you get your first period, is when your brain starts to stimulate your ovary. So just the anatomy of it, your uterus is a muscular bag. The inside has an endometrial layer that can thicken or slough off, has some glands in there too. Your cervix is actually part of your uterus. I know some people don't realize that when we do pap smears that your cervix is a part, but it's all one organ. And your uterus doesn't make any hormones. It just responds to hormones. Your fallopian tubes also have function, don't, to our knowledge, make any kind of hormones, but we know women respond sometimes when we clip tubes, like for tubal ligations, but we'll get into that a little later. Your ovaries are your primary hormone maker as far as the female hormones. They make estrogen, progesterone, and testosterone. Estrogen is made a bit by fat cells and adrenal glands. Testosterone is made a little bit by adrenal glands. But the primary source of your hormones is when your brain stimulates your ovaries to ovulate. Your eggs are all housed on the outside of your ovary under a thin membrane. And in order to escape, they have to form a cyst or a follicle around themselves. So your brain makes a hormone called follicle stimulating hormone that starts to get your eggs to start forming a little bag of fluid or cyst around them. And I've had patients say, oh, I get cysts. And I said, well, everybody who ovulates gets cysts. It's actually a normal function. Can cysts get bigger than normal? Heavens, yes, and can cause a lot of pain. But in a cycle that seems to go under a normal functioning cycle where you ovulate, you don't necessarily have large cysts. So your brain looks at your body as its little world and decides, should we have a baby this month? Are you getting enough to eat? If you don't eat enough, there's lots of people who don't have periods because there's not enough food to take care of two people, and your brain knows that. If you're really active, we're one of the only mammals that run for no reason. Nobody's chasing us. So when you get really active, girls will notice this when they're in high school sports. I had a patient that was trying to get pregnant. She'd run 3 marathons that year. She'd had 2 periods in 12 months. And I said, you're not getting pregnant till you sit down. I mean, it's just your body has to feel like there's a homeostasis there, that there's enough food, there's no danger, because we're just mammals from the neck down. So that's your brain's trying to take care of you and has a higher functioning ability, but this part just wants to stay alive. So if your brain's going to stimulate your ovary only if it feels like all your T's are crossed and all your I's are dotted. So your brain decides, let's have a baby. It makes follicle stimulating hormone for about 4, 5, 6 days sometimes, and it starts to stimulate your ovary. Couple of eggs volunteer by getting a little follicle around them. And in the meantime, your ovary makes estrogen first. Estrogen has 2 main functions. It's going to thicken that inside uterus endometrial lining so that your potential baby has a fluffy bed to live in. But it's also a neurostimulant. Women's brains are high-speed broadband internet, and we want to get online when we want to get online. So when estrogen's high, life's good. You're just clicking, things are happening. It's no big deal. You can cope. And then right before your period, estrogen goes down and can't get online. Some girls don't notice. Some girls cry. I want to hurt people. Some of us just have some really severe reactions to it, and others don't notice it at all, which just goes back to all that. The puppies I talked about last week, we're different. Everybody does this differently. There's not one solution. So as estrogen's going up, in the meantime, one of these eggs, sometimes 2, and you have fraternal twins or more, pops and releases the egg. Now, the fluid in the cyst helps propel the egg up the tube, because eggs don't come with tails like sperms. They have no other little hydropropulsion for them. And now from where your egg came is called a corpus luteum, and it's going to make progesterone. Progesterone has 2 main jobs. A, tell your uterus to sit down and shut up. Don't bleed. We need this baby, this little egg, to find a chance to meet up with the sperm, fertilize, start making an embryo. and give it a chance to actually implant into this nice fluffy lining that your estrogen has provided. The other chore that the progesterone has is as an immunosuppressant. And this is super important because if your body detects your baby, it's not all your genetic material. It's like a tumor. And cancer actually works similarly, where your body tries to attack it and kill it. And if you don't make enough progesterone to create enough immunosuppression, you'll miscarry your baby and you won't be able to carry it full term. So women who do have autoimmune diseases like asthma or ulcerative colitis actually feel better pregnant because that same immune system that's been attacking them is now suppressed. And it's almost like taking steroids or something like that actually suppresses their symptoms. So it does have a benefit for those women that have autoimmune diseases. Progesterone's a neurodepressant. So when progesterone goes high, some women feel great. It's like pot or alcohol. Some girls don't like that depressed feeling. And so their PMS or mood symptoms will be longer than just a couple days before their period. And progesterone's a bit of a vasodilator. And so it can affect your breasts. So women have painful breasts about a week or so before their period. A lot of women don't. We don't all react the same. So you don't get pregnant. There's no meeting of a sperm and an egg. So now the hormones start to shift. So estrogen goes down first. And as I said, might have these mood swings as estrogen is closer to the level of testosterone, which has stayed pretty low and stable right down here. It's now testosterone's unopposed. It could do whatever it wants. So for a lot of women, it'll make you have acne breakouts that happen right before your period. And then the next hormone you make is prostaglandin. You make prostaglandin for about 3 or 4 days, and its main job is to soften your cervix so that you can now release this endometrial lining you no longer need. You're not pregnant. But prostaglandin is an inflammatory hormone. So it'll also possibly cause cramps, flu-like symptoms, diarrhea. I mean, some girls just feel awful and make either a lot of it or just respond dramatically. And I've had some patients say, when I ask them to describe their period, like, oh, I never cramp. And I'm thinking, lucky. I mean, that's the exception, not the rule. But there are some women that's how they respond to that. Last but not least, your progesterone goes down and tells you now you can bleed. Go ahead and bleed. We don't need this. Let's start all over. And that's what a period is. A period is a progesterone withdrawal bleed. Now, if you're bleeding all the time, if you're not having periods for months at a time, and you usually do, it usually means you're not ovulating and you don't have that hormonal cascade that instigates a period. And you're going to feel different. Some women do feel completely different with high and low hormones. Sometimes the high to low is too dramatic for them. Sometimes being low all the time they feel, and some women don't feel any different, whether they're here all the time, months at a time, or this. So we're all quite different. So in later shows, I'm going to go into more detail about what each hormone does and the different reasons as to why you're affected differently or why you may not be ovulating. So thanks, and we'll see you again soon. Goodbye. Have a great day.